Public support for the Republican House health care bill is on the decline. A new poll shows that only 38% of voters approve of the new legislation. That's down from 42% last week. And House members continue to get an earful at town hall meetings about the bill they passed. One of the biggest issues, coverage for pre-existing conditions. For freelance journalist Jennifer Davis, pre-existing conditions are not simply about policy, they're personal. This is her family story.
This is the face of a pre-existing condition. My sweet daughter, Bella. Through no fault of her own or anybody else's, she was born with a rare and life-threatening liver disease. My husband and I became parents through the miracle of adoption. Our joyful daughter was born in 2010, the same year that protections for pre-existing conditions went into effect through the Affordable Care Act. We didn't realize at the time that would soon apply to her. We didn't even know Bella had a pre-existing condition when we brought her home. But 2 weeks later, we noticed the whites of her eyes were yellow. She was diagnosed shortly after that. We were told the disease would take her life before her first birthday if she didn't get a new liver. There are no words for the gripping fear and absolute terror that you feel standing in a children's hospital, holding your baby, watching her get sicker and sicker, and knowing that her life hangs in the balance. And it is nothing short of a miracle when doctors tell you there is a solution. My sister, by chance, was a perfect living donor match for Bella. Jody stepped forward like a real-life superhero when Bella was just 6 months old and donated part of her liver, saving my child's life.
There is another type of beetle.
Her gift of life is priceless. The actual price tag was immense. Even with health insurance, friends have helped us raise more than $120,000 for the out-of-pocket costs that we have had to cover. And there are still costs for all of the things that have literally made Bella's life possible. Blood draws, doctor's visits, medications, and more.
These are disgusting.
She is without a doubt a medical success story.
Good job.
Today, Bella is in kindergarten. She loves to run and dance, to read and to play. She's a wonderful artist and the best big sister that you ever saw. Without protections for pre-existing conditions, Bella could spend her life without health insurance. She would have reached her lifetime maximum before her first birthday. Our deductibles could be raised so high that we couldn't afford her care, and she could be pushed into a high-risk pool, no longer able to see her transplant team, the doctors that saved her life and are most familiar with her care. These changes could put her health at risk. I've heard this week from so many other parents of children with pre-existing conditions, and they're terrified. Everyone is saying, what can we do? I think all we can do is speak out and share our stories, share our children's stories, and continue to fight for them, protect them, and help them lead happy and healthy lives at any cost.